Welcome to the show. Our good friend, Dr. Steffany Mohan from Plaza Dental. It's time to see if we can give you a great smile. Think we can, Doc?
I think so.
Been doing it for how long?
Oh, 20 years. This is my 20th year.
Is it? Happy anniversary.
Isn't that crazy? Oh,
That is great.
I don't know how that's possible. Yeah.
You were really amazing going to medical school at 12.
I was Doogie Hauser.
It was really incredible.
Yeah.
Well, one thing you're wonderful on is you haven't stayed in your practice and done the same thing. You're continually learning new practices out there and new innovations for the mouth and the teeth. And there's always something new coming out. We're even reading about it ourselves and texting you and being like, "Is this true? Is this real?
I
Is this
know
what's
you
going
send
on?"
me messages. That's great. No, it is. It's very exciting. I mean, we live in a very exciting time. We can help people in so many different ways. We have, we can put teeth back with implants like we have never been able to do before. We can create really beautiful, natural-looking smiles like we've never been able to do before. It's just the technology has really helped us out, and it's not as scary as it used to be too. I think that's one of the things that was so hard for people with the dentist. It's so scary for so many people. I mean, like, people will sit in my chair and shake and cry, and I mean, they've just had such bad experience.
I thought we were
it's only Jason. Yeah, I know. Yeah.
So talk about the different practices.
The crying wasn't too bad.
No, the crying was just a couple tears. Talk about the practices that are instilled today that to help people put them at ease when they come into a dentist office.
Well, I mean, frankly, there are drugs. I mean,
Seriously, yeah.
I mean, there's always been nitrous oxide. It's wonderful. It's a really, really
what does that
helpful
do?
thing.
People, they hear about this, but what does that do?
It takes people from a sympathetic state where they're in fight or flight, where they feel like they're being chased by a lion, or literally, or something like that. So where they're in danger, where they feel like they're in danger. Because people sometimes, literally, when they sit in my chair or anybody's chair in the dentist, they feel like they're in danger. So yeah, they're white knuckling. They really feel very. They're just scared, and it's a normal reaction for so many people because they're conditioned to be scared in the dental chair. So it takes them from that sympathetic state or the fight or flight into a parasympathetic state, which is a relaxed state. And that's when you can relax. The anesthetic will work very well. It just helps people to deal with it. And it's not something that it's, I mean, we would never make fun of somebody for being like that. We would never, I feel so badly for people because it's so real. I mean, whatever you're really scared of, it's real. It's not you don't try to be scared of something. It's just something that you feel. I'm scared of roller coasters. I can't get myself. My kids make fun of me, but I can't get myself to go on that. That's a real fear. It's just something like that. So any fear is a validated real fear. So we help with that. Yeah, I mean, there are medications. There are relaxation techniques. I mean, a lot of it is just getting used to being there and being okay with it. I mean, a lot of times people will literally walk in the door, have their first appointment, and just sit down and talk, and we don't even touch them. They just need that just to feel comfortable in a space.
Get a little relaxed.
So it's not weird that I do that?
No,
Okay.
no.
Well, we go over
I had a guy bring a teddy bear in one time with him, and it was kind of a joke, but it was funny. I mean, he just was that
But there are people that go for years without getting even looked at.
I mean,
dental-wise.
decades, literally.
Decades?
Some people go, oh gosh, yeah. I mean, it's very common for people to go years and years and years and years. And some people, I mean, I've had people show up at 50 years old and they've never been. I mean, it's really.
No, in that case, let's use that case.
Yeah.
Somebody has gone a decade or two or even longer.
Well, they've clearly not had horrible pain, or they haven't had like a major issue.
I was going to say, is it one of those things they don't come in until it's like, oh, I have pain, now I have to go?
That's usually what happens.
But should they be afraid to come in?
No, gosh, no. I mean, they're probably in better shape than a lot of people just because they haven't had the pain or anything. And there's such a variability. I think people need to realize we see people that are, like Jackie, that have perfect teeth, and we see people, everything in between, and people that have just really, really difficult issues. I mean, hard things going on, and they're more afraid to come in and have us, tell them that something's wrong, but they know something's wrong. So it's not, they're already in pain. They already have something broken. They already have something loose or something like that, and so they know something's wrong. So it's okay to come in and just talk about it. I mean, But don't you think there are offices that are better than others of making you feel welcome and comfortable? I feel like I'm having almost a small spa day when I'm coming to your office. Thank you. Yeah, I mean, I do think, that is definitely one of our goals, is to make everybody feel very, very comfortable. Some people don't. I mean, there are people that walk into our office and they don't feel super comfortable. And you know what? They need to find the right fit. Everybody needs to find that. So, some people are comfortable with the person that cuts their hair, and and some people need to find somebody else. You have to find a comfort zone with whatever you do.
And a comfort there is also knowing that no matter what the issue might be, you guys are going to have a solution for it.
Yeah, and we always say, you know, we want it to be comfortable, you know, pain-wise, we want it to be comfortable financially, and we want it to be comfortable, we want them to feel like they're kind of part of the family, but really all of that comfort, it just helps people to be able to make the right decision. And the choices, whatever choice is right for that person.
So let's talk about some of the technology that is out there right now. If people might be having an issue and be like, you know, I've always worried about this, or what are some of the fixers out there
Well, a
right
lot
now?
of people, you know, there's so many things that happen in dentistry. A lot of people they don't like to have impressions. So if they have a crown or something like that and they have to have impressions, they gag
Make
on
you
the
throw
impressions.
up, yep. Mm-hmm.
Right? And so we have digital. It's just a camera that we put in the mouth and we just, you know, we scan the tooth instead.
Okay.
And so that's really simple, a really easy way to do that. It helps people that have that fear of gagging, or they've always had, you know,
reflex,
issues. I know, gosh. There's so much of that. And then we have digital X-ray, we have 3D, we have a CT scanner in our office that we can use. So we have lots of great technology that really just makes it easier for people, and that's the whole goal. So, and it's fun toys for us.
To play with on the other end.
Really, if you have not been to the dentist for a long time and you know you need to go to the dentist, this would be an opportunity to come in and say, okay, here's the deal. What can we do?
Yeah, exactly. And just come in, sit down and talk. I mean, that we do free consultations. So I mean, there's no risk for somebody to come in and talk. And that's, to me, that's a comfortable thing for people too, where they don't feel like they have to take a risk financially to just come in and sit in the chair.
Just keep that in mind too.
Yeah.
Definitely. Well, wonderful. Well, thank you so much.
Thank you.
Made me feel more comfortable. I'm not even at the dentist.